Good evening, everyone. My name's David Howard. Welcome to Kellogg College, and welcome to the GCHU, the Global Centre on Healthcare and Urbanisation Public Seminar Series. Delighted for you to join us this evening. We will have an hour's worth of talks and questions, so do engage in the debate afterwards, and then there's wine and nibbles afterwards for all those who are hungry or thirsty. We're delighted to have our panel today, and thanks firstly for Dr. Raluca Matai, who's been at King's Foundation. She's a research associate in health and well-being and an applied health psychologist. Raluca has organised, curated tonight's panel, so she will be doing the chairing, and so we will have an hour or so of discussion and questions, and then over to the drinks nibbles. And welcome. There we are. Over to Can Designing with Nature Reduce Health Inequalities? Raluca, over to you.
Thank you so much for that very warm welcome, David. Welcome, everyone. It's really nice to see you all here. You will hear tonight from 4 speakers tackling one overarching question that you can see on the slide. Can designing with nature reduce health inequalities? It is a deceptively simple question and a deeply complex one at the same time. In fact, it's what scholars call a wicked problem, one where the requirements are incomplete, shifting, and often contradictory, where there is no single answer, only better or worse ones, and where the very way you frame the problem shapes the solution you will end up reaching. The honest answer to tonight's question is almost certainly it depends on who is asking, who is designing, and the broader web of context surrounding both. If you were hoping for something more definitive, I'm afraid you may have come to the wrong seminar. But do stay, though. Like climate change or poverty, wicked problems demand that we draw from multiple disciplines at once. And this is part of what makes health such a compelling lens. Our health is shaped by an extraordinary range of forces, individual behaviors, social circumstance, economics, politics, commercial interests, ecology, and also ideology. The values and priorities a given society holds in a given corner of the world at a given moment in history. No single discipline can claim ownership of it. Health requires creative, cross-disciplinary thinking, which is precisely why having such a varied panel tonight is not just interesting, but necessary. You are welcome. Adding nature into this conversation feels both urgent and strangely obvious. And yet the moment you look closely, the complications multiply. Is all nature equal? Is access enough? Or does it matter how nature is designed, maintained, and experienced? Can a city build its way to health equity with green space? Or are we sometimes asking nature to quietly compensate for failures that run much deeper? In planning, in policy, in the conditions that allow people to feel safe, valued, and connected in the first place. And crucially, who benefits and who gets left out? We are overdue a serious conversation about this. If the answer is it depends, then we had better start mapping the dependencies now, while we still have the time and the imagination to act. I very much hope you take something genuinely useful away from tonight. If not, I'm afraid there is absolutely nothing I can do about it. But I will feel bad, briefly at least. So on that note of cautious optimism, allow me to introduce our amazing speakers in the order in which they will appear. So first we have Dr. Matilda van den Bosch, senior researcher at the Barcelona Institute for Global Health, senior researcher at the European Forest Institute, and adjunct professor at the University of British Columbia. She is a physician and interdisciplinary researcher who has spent more than 15 years studying the relationships between nature and health, specifically how urban green environments, forests, and nature-based solutions can support human well-being, resilience, and climate adaptation. She has advised international organizations, including the World Health Organization, and in 2025, she was recognized as a highly cited researcher, which means that Other very clever people keep referencing her work, which is generally a good sign. Next, we have Sophie Hawkin, founder and director of the Health and Place Project and the Chartered Town Planner. In 2025, she was recognized as one of the Planner magazine's Women of Influence for her exceptional contributions to health infrastructure planning and estates transformation. Sophie has recently completed an 18-month program of work with the NHS North East London Integrated Care Board, leading strategic initiatives to ensure that healthcare infrastructure actually meets population needs. Her work spans influencing policy agendas, integrating public health priorities, and aligning projects with the NHS 10-year plan. We'll then hear from Marta Saniewska, environmental psychologist in Foster and Partners Urban Design Team, a rare and rather enviable combination of psychology and architecture. That means she can probably tell you both why a building makes you feel anxious and what to do about it, hopefully. Marta applies research from psychology, neuroscience, and public health to help architects create evidence-based designs, working across scales and typologies that range from healthcare and education to public realm projects and post-disaster reconstruction master plans. Her work is fundamentally about enhancing well-being through design and making the case clearly and rigorously that the built environment is a public health issue. And last, but absolutely not least, we have Dr. William Bird, MBE, who has spent decades being considerably more optimistic about human behavior than most of us manage. As a family GP in the 1990s, he pioneered the concept of social prescribing by establishing the first health walk scheme and the first green gym before social prescribing was even a phrase that people used. In 2010, he founded Intelligent Health, with a mission to build healthier, more active, and better connected communities. Its flagship program, Beat the Street, has now reached over 1.8 million participants worldwide, backed by evidence on sustained physical activity, behavior change. He is, in short, proof that one person with a good idea and a lot of persistence can actually move the needle. A quick word on format, just as a reminder. Each speaker will have no more than 5 minutes to make their case, and I will enforce that with increasing levels of visible discomfort if needed. After that, the floor is yours, the audience, for about 30 minutes or so. I very much want to hear from you. At around 6:30, I will reluctantly bring the formal discussion to a close so that we can move on to drinks and nibbles, where you are, of course, very welcome to continue solving the wicked problem informally. So without further ado, please join me in welcoming our speakers. Thank you so much.
There we go. Thank you very much for the kind invitation and for the kind introduction as well. So I'll jump completely directly in to not waste my minutes here. Talking about wicked problems, one of the most striking realities in public health is that where you live to a high extent predicts how long you will live. Within UK cities, just a couple of miles apart, the life expectancy can differ more than 10 years, which is then determined by your postal code. The global disease scenario today is another interesting or striking example of the public health changes, because we used to suffer a lot from infectious diseases, but today we're suffering mostly from chronic diseases such as cardiovascular disease, depression, and stroke, for example. And these kind of chronic diseases are much more common among vulnerable populations. They're often associated to social factors and environmental factors. And exactly because of this, it's important that we consider the environment to improve health. And talking about the environment and what environments are healthy, we know from a lot of research that nature is good for us. And we also know that green spaces can reduce income-related health inequalities. This is a landmark study that was published in 2008 by Mitchell and Popham in The Lancet. And what basically tells us that the greener the neighborhood, the smaller the gap that is determined by income inequalities. So it seems like there's something with the green space, with nature, that buffers the chronic stress that socioeconomically deprived populations suffer from. This study has been replicated, and we see similar patterns for mental health. For example, this study was published in 2015, and you see again the slope is much flatter as you increase to more green in the neighborhood. And this one was interesting because they only saw this, the authors only saw this pattern for green spaces, not for other neighborhood services that they looked up. Okay, great, you think. So then we know that access to green spaces improves or reduces health inequalities. So we should just increase access to green spaces. And then the reality strikes. This is what it looks like from above. If you look at Google Earth, for example, you can quite perfectly determine socioeconomic differences in cities, where you see green, lush neighborhoods, and then much less green neighborhoods. And this is reflected on the ground by more profound socioeconomic inequalities. Cape Town, Mexico City. So these were examples from the global south, but we see similar patterns in Europe, including in the UK. So, for example, in London, and you see here the northeastern part where there is less tree canopy cover, and this is associated with income inequalities as well. And across Europe, there is also inequalities in the cooling services that are provided by green services. So the more deprived areas have less access to this cooling service, and so which increases the heat-related mortality and morbidity among those that are the most vulnerable. But it's not only heat reduction that promotes health through nature. There's several pathways. And we now have decades of research that show that greener neighborhoods encourage physical activity, it enhances social capital, it reduces stress. And this translates to a number of different health outcomes, ranging from a reduced prevalence of cardiovascular diseases to happier children who perform better in school. So now we know this, we have sufficient evidence to say that nature is good, green is good. Then it becomes almost unethical to notice that we have this discrepancy between neighborhoods being more or less green. So those with relatively less contact have a health disadvantage. We don't provide green spaces to those who need it the most. And this has an impact on a population level. Estimates or studies that do these kind of estimates, we do health impact assessment studies quite a lot at my current institute. And by living up to the WHO recommendations for access to green spaces, it's estimated that tens of thousands of lives could be saved each year in Europe. And the sad thing that only 40% of the population actually has this healthy access to green space, while 60%, which tends to be the more deprived, has less access to these healthy neighborhoods, healthy environments. Just another numerical example, we also know that by increasing tree canopy cover in neighborhoods with 30%, we could reduce the heat-related mortality with 1/3. And this is important because we know that deprived neighborhoods will be the ones suffering the most from the increasing heat exposure due to climate change. These types of interventions are often referred to as nature-based solutions, which means actions that are using nature to address societal challenges while simultaneously providing benefits for human health and for biodiversity. And this touches upon a topic that I hope we can discuss a little bit later on, which in terms of multi-species justice and multi-species health as well. Nature-based solutions are increasingly also discussed in terms of climate change mitigation. And this is a study we published a couple of years ago looking at how forest-based climate change mitigation. Forests act as carbon sinks, and the most efficient forests for carbon sinks are also those that are managed for recreational purposes. However, we know that we cannot just implement nature-based solutions. We also must do it in a very equitable and inclusive way. And recent research has highlighted 3 pillars: inclusivity, justice and equity, and empowerment, to really ensure that these nature-based solutions are equally distributed and that the communities are engaged in the decision making. This is the only way we can use it to actually reduce health inequalities. So this is a complex challenge. We know that we cannot just increase green spaces in cities, but the most important, or as important, is that it's equally distributed. But the key message is simple: your postal code should not determine how long you live. Urban nature can contribute to closing that gap. Thank you for your attention.
We can all agree that in an ideal world, nature can be medicine, but this makes a number of assumptions, not least that people have a shared understanding as to what nature is, what they want from nature, and that they have time to spend in nature. The final point is key to understanding what nature's role could be in reducing health inequalities, particularly through design. Those suffering from the worst health inequalities are often living in the most deprived communities, as we've just heard. They are also often the people who are working multiple jobs in order to survive and may have very little spare time. How can we bring nature to them? We know that housing is a key driver of health inequalities. Although new homes are being built and policy aims to secure biodiversity gains, these approaches have not been translated into greater prosperity or improved well-being for the communities experiencing the worst deprivation. I've spent most of my career working in East London, where regeneration schemes of varying sizes have been plentiful. However, evidence from organisations such as the London Prosperity Board have clearly demonstrated that regeneration hasn't reduced inequalities. If anything, the evidence is actually telling us that whilst more affluent people have moved into neighbourhoods, existing residents have actually become more deprived, not less. This is in part due to the expectation that the market will deliver the right homes for the right people in the right places, which it hasn't. Nature matters, but it isn't enough. A single mother with 2 children who is working multiple jobs to make ends meet whilst living in temporary accommodation may in fact not care about access to nature, particularly if it meant that she knew that she could afford the rent, would have a secure home until her children reached 18, and would have access to the health and social care that she requires. Access to nature in the form of green space has also proven not to be enough. There are hundreds of examples of estates in deprived areas which provide access to green space, such as the image on the bottom of this slide. The spaces often lack natural surveillance, haven't been well maintained, and are perhaps unattractive places to spend time in. There is evidence that even suggests that if the places are poorly maintained, they can have a negative impact upon health outcomes, particularly in relation to mental health through fear of crime. In order to be beneficial, access to nature, particularly in the form of green space, needs to be designed into developments, akin to the image at the top. This development has natural surveillance, opportunities for connection, as well as places for people to sit. There are more opportunities for people to choose to spend 10 minutes in this space than the other space. Leading on from this, I've developed my concept of nature snacks to provide everyday access to nature for everyone in a meaningful way. For most people in the UK, what free time they have is often outside of daylight hours, particularly during winter. Therefore, key to encouraging people to spend time in nature or outside is to make it feel safe in the dark. Nature must be part of the fabric of everyday life, designed into where people live, must feel safe and part of a routine, and enable a quick 10 minutes of fresh air to support well-being. I've also been asked to focus particularly upon the tensions within the built environment and nature. From my work with a range of NHS trusts in London, it is clear that the prioritisation of nature can actually have a negative impact on hospital sites. Hospital sites across the country are constrained for a variety of reasons, be it ageing estate or funding processes. Development has often had to take place in an ad hoc way, meaning that strategic site master plans are but a CEO's fantasy. Therefore, most hospital sites are a jigsaw puzzle of pieces that are all in the wrong places. Planning policy is increasingly seeking to prioritise nature through biodiversity net gain, local no net loss policies, but this means that increasingly constrained sites are becoming even more inflexible. Ultimately, this isn't reducing health inequalities. It is becoming burdensome and confusing from planning requirements, which are making it harder for people to be healthier. So to wrap up, nature and the services it provides are essential to both humans and the physical world. However, they are not the silver bullet to reducing health inequalities. Housing is one of the wider determinants of health that can have the greatest impact on reducing health inequalities. In terms of ending on a provocative question, the key from my perspective is, are we increasingly asking nature to compensate for the failings of the planning system and the wider state? And if so, what does that mean for designing truly equitable places? And hopefully that's just under the 5 minutes.
I'll set up my timer so Raluca can relax. Thank you everyone for coming, and I will talk about how not all nature is equal. So when we think of nature, those are the kinds of images that we usually imagine, very natural wild habitats from forests and meadows to wetlands. But when it comes to the perspective that I'm coming from, so a design background, architectural practice, this is the kind of nature that I'm talking about, where it's contained within a built-up man-made landscape. It's curated. Some would even say that it's interrupted and even question if that's nature at all. But let's take a step back and look at the public health perspective, something that's already been mentioned. So for example, visibility of greenery from one's home, distance to a public green open space, and absolute coverage, absolute green coverage within a neighborhood can influence someone's likelihood to reach for antidepressants in the first place and their decision to stop or continue taking them. In terms of physical health, for example, 60% of green coverage in neighborhoods seems to be an optimal amount for decreasing diabetes risk by up to 20%, even after controlling for factors such as family history of diabetes or BMI, which are very influential. And we've already touched on the many mechanisms through which that happens, from stress reduction to environmental mitigation, which can reduce noise and help us sleep better. But and a lot of the, sorry, I'll go back. A lot of the research in public health actually looks at absolute greenery percentage. So it looks at satellite data, but not really at the quality of space that's there. And I think that we should really think of the perspective of biophilic design and look at the very multisensory landscape, thinking about designing with natural materials as well, about opportunities for tactile interaction, auditory, olfactory, very multisensory landscapes. And at the bottom, we can see how it impacts our physiology at an individual level, from lowering our heart rate, even decreasing our muscle tension, to influencing our brain activity patterns, increasing alpha waves. And some of the timescales through which that happens can be as short as 90 seconds of touching natural wood in this case. And when it comes to a design perspective, oftentimes within a design firm, we're working with a very limited amount of nature within a urban setting, and the question sometimes is it better to increase the absolute percentage of that greenery, or is it worth maybe cutting out little pieces to really focus on the experience that people will have within that space? So in this case, Foster and Partners was doing sort of a renovation of Bishop Square in London, and they chose that it's better to reduce that absolute amount by cutting out those little pieces, but that can actually help to create a much more immersive experience with elements of prospect and refuge and more interaction with sort of the landscape around. And that led to a space that looks like this in a very bustling, busy city center. Also, water features are an important element of designing with nature. And I'm actually very curious what you think about an example like this, where some of the sort of nature was removed to actually sort of give way to people and increase that interaction. And in terms of treating a water feature as an object, which is not really accessible, it was removed so that people can touch it, can hear it, and can really be a part of it. This was a renovation project in Madrid, which introduced a biodiverse landscape. It was very sort of climatically conscious in terms of renovating the building, but also the landscape itself. And as has been mentioned, biodiversity can really enhance those benefits, especially in terms of mental health. The landscapes which are biodiverse are seen as more restorative. And in this case, we also need to think about it in a holistic way. So for example, a water feature is not just very restorative for the people in it, but it also helps to maintain that biodiversity. Birds or butterflies can come in and drink it. And I have this image up here to say that designing with nature is not just designing with planting alone, it's designing with those biophilic design elements such as timber, for example. But timber is never the same. It has different hues, it has different patterns, and also different visual complexity. And that's also to say that a lot of the research in environmental psychology or public health doesn't limit designers' creativity. It can actually enhance it, such as shown us through these different patterns, which would have different physiological impact on people who interact with it. And I wanted to finish by saying that we should question whether the outcomes really align with the design intent, and we should really go back to the site, because it's all nice in theory. We can use the research and we can speak with the designers, but unless we really measure it once it's there, we won't know if it performed well. And we need to look at what are the mechanisms and what are the features of those places that really work, that people enjoy, and that impact their health. And so I think the question is not necessarily, does nature improve our well-being and reduce health inequalities? We agree on that, but it's whether we design it in a way that truly allows it to do so.
So I'm going to talk a little bit about what health is and how nature can connect with that health. So health is increasingly being thought to be because we have a finite amount of energy in our body, and if that energy, we're going to go up a bit, and if we become chronically stressed, we use up that bit of energy that's meant to be for growth and repair, and therefore we haven't got enough energy left to do the repair of cells, and therefore they get inefficient, and then they get diseased, and then we get lots of diseases, and possibly all diseases that we know about are from that pathway. And we now know you don't need to be stressed with stressors to become chronically stressed. You just need to not feel safe or valued or belong. So those three things are the human, mammals, animals everywhere. We're no different as we are nature. And then there are three domains in our life that actually help us deliver that. So people around us, the place around us, and our purpose of who we are. And then if you put those all together, you get a matrix there. And we've been doing some work to try and understand that if we have that perfectly right, people will have the conditions to be able to feel safe and valued and belong. And we can put trust and love in there, respect, community, autonomy and hope, fulfillment in the middle there, values, secure. And this is where we come to the place bit, the resonance and rootedness of belonging, sense of place. And we put some questions as well. And we've actually, through our game of Beat the Street, we've managed to get about 70,000 people to answer those questions from where they live. And we have tracked it all down. So we can plot down to a road what those values are. And it allows us to get into real detail of understanding. So in Salford, where we got about just under 2,000 people to answer, we then plotted from Natural England's database about where the accessibility of nature is by LSOA. And then we looked and see if there are any connections between poor mental health, inactivity, and life satisfaction, and there wasn't. No correlation at all. But if you add mediators of health creation, it all comes to life. So we were starting to think then, so what is actually happening? So what's happening is, just as we've heard, and everyone is so brilliantly kind of going in the same direction here, that if you just put green space in a very deprived community where safety is not felt, it actually becomes more of a danger to people, and they actually feel more stressed because it becomes derelict, it becomes unused, and there are problems there. So the mediators we found actually are the feelings of attachment to the neighbourhood, enjoyment of pride, connection to nature, social trust and belonging. When you look at that, then you start to get a position where you had those mediators make a connection between that green space and those outcomes. And then we can look at the life satisfaction of what happens if we actually put 10%, everything got 10% of green space in those wards in Salford. And some of them would benefit quite a lot because they don't have any green space at all, but they won't benefit if there's no mediators either. So if you put a lot of green space in a deprived area where there's no green space, it will make a tiny difference, but there's no activation of it. So what we're looking at is a combination of no green space and some activation of those connection to place, connection to people. And when you do that, you can go down the wards and say, okay, if you put it into these wards, you'll get a real good bang for your buck. But actually those other ones are either really affluent already and have got lots of green space, in which case nothing will change, or those high ones are very really deprived. Nobody's going to do anything with those green spaces and they won't be activated. So you just have to have a bit more of that social connection. Now, of course, it means you have to really drive hard to those really deprived communities to be able to start to build them up. But as we've heard, very often it actually widens the gap because green space can be quite dangerous. And so green space doesn't raise life satisfaction by just being there. It does by strengthening everyday experiences and make life feel more meaningful and secure. And if you look at the gap between a woman who is female in a long-term condition in a really deprived area, you'll see that most questions, the gap between the orange where she is and what other people, all of that stress is pulling her away from feeling safe. And that's a gap we're getting as a real problem. So this is called health creation. It's at the top. It comes well before the lifestyle factors and prevention and treatment. Thank you.
Thank you so much to all of you. That was a really nice emphasis of the importance of context, and thank you so much. Okay, now over to you. Any questions for any one of the speakers?
I'm really sorry, but William Bird, do you think you could just go back to your last slide and spend just a little bit more time on it, because it was so hurried and so brilliant. Would you mind?
I'm hurried, but I don't think brilliant, so to be honest. But
It's everybody.
so it's the thought that if you don't feel safe, you're going to feel stressed, and chronic stress now is thought to be one of the key factors, obviously, of ill health, particularly in children where there's a very small gap of energy because you're growing, and old people where there's a very small gap of energy as well because you haven't got much energy left. So in the middle, the people who design everything and the people there, actually, we don't mind too much. So health creation is really important, both for children particularly and for older people, but for everyone. And then if you get that right, then you will find for physical activity, diet, smoking, alcohol will all fall into place, because all of those, and if we go into those, actually are problems of trying to survive. So we become less active because we're trying to save calories. We eat the wrong things because we're trying to get more calories. So it's all survival. And then, of course, you get to the NHS, which does our stuff of lipids, hypertension, that kind of prevention, way too late, way too late. Even going into physical activity is too late. You have to get the top bit right first. And then actually everything will start to flow. Prevention looks at disease, health creation looks at a good life, basically. And then obviously the bottom is where the NHS spends 95% of its energy and money.
Thank you. Thank you all so much. So a lot of really wonderful ideas in that. Just to call on a couple of them. So specifically, I work in environmental remediation, so pollution cleanup. And I've seen with some remediation projects, the solution has been to kind of put in these ecosystem services in the forms of green belt, even when they've been done very consciously to try and address how do you make communities feel safe. And these are also communities that have been living around pollution, so they've generally incurred a lot of chronic health issues from living around just contaminants. I was wondering if any of you have any experience working around the issue of green gentrification. So when you see these, parks or areas go in, even when they've engaged communities, and then these people can't afford the rents anymore, or their property taxes go up so much. This is kind of maybe a US specific thing, but their property taxes go up so much that then they're displaced to other neighborhoods that maybe lack these services or have other public health crises. If anyone has any experience, because I know it's a wicked problem, but curious if any of you have experience with that.
Yeah, I will start discussing that. I don't have an answer, but for sure, green gentrification is something we need to consider, and it's something we discuss all the time. Oh, not all the time, but that's clearly a problem. I would say that, okay, we are part of nature, and I think that is a little bit, we need to strive towards a mind shift there, or a paradigm shift where we really start realizing that we need to incorporate nature in our lives, and we also need to incorporate ourselves into nature. Then it cannot become, we cannot have it as a discussion anymore, whether we should preserve nature, whether we should preserve biodiversity, etc. That is clear. I mean, that's for the health of the planet and for the health of ourselves. We need to keep on working on having more nature and having it more diverse, and ecosystem services, etc. So we need to address these issues not by not creating green spaces, but with regulations, bylaws, like decisions, like from a policy perspective, in a completely different way. That's how I see it.
I suppose I'm coming at this from a slightly conflicted position, because earlier in my career I worked for the London Legacy Development Corporation, which is all around the Olympic Park area in Stratford. And on the one hand, you've got probably one of the most well-used legacy Olympic Games sort of sites in the world. But on the other hand, you've got an area that, through gentrification, that has predominantly been around the park, and whether that park is actually what people who had previously lived in the area wanted, I don't know. I wasn't involved that early in the process. But I think the work that William's done in relation to Salford, and actually really kind of understanding what existing populations want, is really important. And I think, whilst it's a wicked problem, that is almost key to really making sure that the green space that is put in actually serves the population.
I'll just add that it made me think of an initiative that I read about recently in an article by a lawyer who established this organization called Lawyers for Nature. And he was talking about how he thinks that there should be advocates for nature in every urban planning meeting, someone who actually imagines that they're nature and that they're almost hurt by certain developments and then argues for that. And I think that's a very interesting idea. And if that becomes sort of enforced within planning meetings, for example, that they can then ensure that that nature becomes part of the community and doesn't displace anyone, because it's just a very integrated process and has the same sort of weight in terms of their vote as everyone else's perspective.
Hi, thanks for the presentations. They were all very good, and I agree totally with having nature in the built environment. I was wondering if there was a difference, if anyone knew, between having a private space that's available to you or a public space, if that affects outcomes. For example, a garden or a balcony.
I think one one of the things that public green space does is that it's that, as we heard about the community, it's the connector for the community. And if it reduces that stress because you feel safer, then you actually become much more connected with other people. So your oxytocin goes up and you start to feel much more connected. Private space obviously is very safe. Is very safe. So you've got that ability to be able to connect with nature quite carefully, and you feel safe and it's there, but you miss out on that whole community aspect as well. So there are some benefits clearly from having a private garden where you can connect to nature, but you're also not losing, you're losing some of the benefits of nature, which have all been for mankind, to say, to actually be using it as a public space where it really does help. And we know from a health point of view that connecting to people is probably the single most important thing that we have to do for our health. So yes, you're going to get some of the benefits, but you're not going to get all the benefits from having private gardens. And of course, it excludes other people because that private space is now no longer available for other people. I think planners will have probably more, and architects more to say.
I would just add that I think it's also about the activity that you can do in there. So the benefit of having a private garden is, for example, that you can actually garden in it. You can sort of interact with the soil and you can care for your plants, but you can have the same benefits from like allotment gardens and sort of more from like publicly available spaces that allow for that sort of interactive gardening. But I would say that that's one of those, I guess.
I think probably I won't say terribly more than William on the subject, because I think there's benefits of both private and communal space. And actually, you know, some people may actually prefer to be more social and sit outside and perhaps partake in sort of a gardening club or something along those lines within their space. But then other people might just prefer to sit on a balcony and enjoy the sunshine.
Yeah, just quickly adding that I guess it's also more common for wealthier people to have a private garden, so there already is an inequality. And in dense cities that we need to build today, is also getting more and more impossible to have private green spaces for everyone. You wanted to add something?
Yes, because I'm an architect and I worked in Norway, and they will, part of their planning and the process is that every apartment, there should be at least some outdoor private space, whether it's a balcony or a small garden. And they also advocate in lots of housing projects that they will be community space. So I think both are important.
Yeah, I guess that's safe to say.
So I just want very quickly to add on that point that I think it's also about visibility of nature from your house. So there's a lot of research that it's the visibility of trees, sometimes even more so than access to an open space, that has this mediating effect. So I guess it doesn't have to be a private garden, but if you have trees outside or even a balcony with like a row of planting, that could already help.
I think I'll just add there that I think you've completely hit the nail on the head in that actually you need both. And maybe we should be designing both. Maybe, so I've predominantly worked in London for the last sort of 10 years or so, and I know the standards in London are quite prescriptive in a way that they perhaps are not elsewhere in the country. And actually, should we also be looking to other countries, such as Norway, such as other countries in Northern Europe, that we can really learn from and implement the ideas that work?
Thanks so much, the speakers, for the amazing talk today. So I work on the mental health benefits from different type of green infrastructure at the School of Geography. So I'm very glad to hear all the exciting talks and all the citations from the first speakers, like really exciting. I have one question that people always ask me, like when we're talking about benefits from green spaces. I think I mentioned in today's talk is like, how do we kind of capture the access to blue spaces as well? It's like, do we treat blue spaces as a part embedded in the green space? Or it's like, so in the current theory that William, you kindly touched on, we're talking about stress reduction, attention restoration, biophilia hypothesis. We're talking about view shed to, like you have a view to the trees, you have a view to the green space. And I was actually a bit curious in this area. It's like, so is there theoretical support, or is like work a similar way about access to green, blue spaces? Of course, the interaction to green, blue space is very different. We have coastal cities over here and inland bodies. So I'm a bit curious on this end. Thank you.
Let me start again. So there is some research. There's less research on blue spaces compared to green spaces, and there seem to be different. The little we know, there seems to be differences. So maybe the mental health benefits are actually even stronger for blue spaces compared to green spaces. For me, it's a little bit more complicated, because if you're going to use it for planning and policy, it's more difficult to bring in blue spaces compared to planting trees and plants, etc. So for sure you can create a fountain or whatever and a pool, but it's not exactly the same, and it's a little bit you don't get the same kind of ecosystem services from it. But yeah, there's some studies on that.
So it's funny, I'm just doing some work for the Canal and River Trust about the nature benefits, and it's all about context. So the canals run through the most deprived communities in Britain, and therefore it's accessible. So when we look at the people who are visiting the canals, they've got the highest anxiety, the lowest mental health, the lowest physical activity, and the most deprived, which is perfect, because they're the people you're wanting to get. And it seems to be that a lot of them feel quite safe around water because that's how they've been brought up, and less safe about green space. So it's very much context. When we look at canals specifically, they are incredibly important for maintaining mental health, because they're going through those very, very difficult deprived communities. When you look at the sea, of course, that's completely different, and it's blue. You know, we put blue space all together, clump it together, but actually I think the sea is probably quite different in that respect. But rivers tend to be actually more affluent areas. So when we look at blue space, yes, I think the ripples and the sunlight and the noise and everything have all been added, and researchers have shown how that all adds. But the context of how you see rivers, lakes, ponds, blue space, I think it's the context of where they are is almost more important than the actual blue bit.
Yeah, it was really just how we can start to conceive urban design and planning as a, you know, in sort of institutional level, or through whichever actors are, how you turn it into the sort of public health opportunities that you're talking about. I mean, in the post-war housing, the new towns, and even before the origins of social housing, it was, you know, it was a public health issue. It was Ministry of Home of Health that developed the houses in the post-war. So I just wonder where you see the levers of opportunity, or, you know, how do you start to see public realm as a public health opportunity? I mean, I just on the map that you had of East London, like Dagenham is an area that I know, and it's just tragic that you walk through these streets of Becontree Estate, and there's no trees. I think they might have had trees at one point, but they've been cut down as like a, you know, a maintenance issue. The same things happen in Sheffield and places like that. So just, yeah, I don't know how do we start to just change things?
I think certainly from my perspective, I've become really interested in how sort of a cost saving could potentially be valued. And I know William's done more work on this, but certainly I think once you can kind of start to see some form of benefit in terms of cost saving, because I think a lot of these issues have arisen as a result of austerity and as a result of cost saving, cutting back on maintenance, cutting back on public toilets, essentially making areas more difficult to a certain extent for people to spend time. And I think if you can increase the use of the space but also try and demonstrate some form of economic benefit to that, then I think you can start to really change the conversation, particularly in the current climate where essentially cost saving is still key.
I think there's also there is a political side to it. So the More in Common did a report quite recently about how the government should spend the money for Pride in Place, which is going to be £5 billion over the next 10 years in the most deprived areas. And they went to those very, very deprived areas and they said, we want green space. We want good quality green space. That was number one out of all the things. That was more than high street regeneration. That was more than the service, other buildings and other things. That was more than almost anything else. They want it. So I think there's a very, the public really know what's good for them, and as they always do. And I think we should be listening to that. I think the evidence, cost effectiveness, I mean, Matilda, your first slide had that thing about the number of lives saved, can't remember what it is, 45,000 or something in Europe. If added, the evidence is all over the place of doing it. But I think it is coming down to planners, master planners, of how do you actually pull the levers to make it happen. And it's understanding what green space is needed. So we've got the public crying out, we've got the evidence pushing for it, we've got a kind of a new way of looking at planning, which should be much more consultative with the public, and yet we're still getting it wrong. And I don't get that. I don't. Perhaps I some others about why you say about cost cutting, but why is it we're still getting, with all that evidence, we still are developing little boxes with no green space attached, or a bit of token green space on the edge? Stop asking a question here.
I don't have an answer to that question. But I just wanted to add that also from like a design perspective, this research about economic value is very, very helpful actually. And oftentimes even at Foster, we do have conversations with clients where we try to convince them to sacrifice like part of their plot to give it to the public. And oftentimes that's then landscaped and turned into like a green area. And those studies, which also show that people who spend time in nature are more likely to like spend money and linger, and they're actually very, very helpful to make a case for better public realm and improve public health.
Hi, thank you. Just a quick one. I think in answer to Marta's question that you've raised in terms of whether we want to interact with nature and how useful that is, because one tension that comes up probably in all of your lines of work is us interacting with nature and the benefits that has, but also looking from the biodiversity point of view where it's actually a lack of interaction with nature that is helpful for biodiversity. So it's almost the opposite end, and prioritizing that. And particular point that was just mentioned just now in terms of having these kind of isolated squares of green space in London and the importance of corridors that we know for biodiversity and the proximity of, for example, spaces. So rather than just having isolated blocks, there is a connection so that species can travel and can live and thrive. So where do you get that balance between, yes, interaction that we need in terms of the social and the health benefits, but then we also need biodiversity itself. We need the nature to be left alone, essentially. How do you see that tension playing out in your lines of work?
From my perspective, there's a fair bit of that, to be honest. But we do have an in-house ecologist. So I think it's all about this interdisciplinary collaboration. And actually, when I was making my slides, he was sat next to me and he like saw my screen. He was like, "Oh, so you're removing nature and animals to help people feel better, but how does that work with the slide of the sort of the water feature?" And I think that is an important sort of paradox and something that we need to address. And I think, like in terms of research from environmental psychology, there is all this all those studies about interaction, tactility, being able to be very close to it. which, as you said, distracts sort of the flora and the fauna. But I'm sure there are ways of reconciling this, and even in, I think, London fields, there are also areas of just wildflowers, for example, like wildflower meadows that are just slightly separated from the area that people use. And I think there was a concern that people would stop coming and stop using it because part of the park was sort of taken away for the sort of biodiverse strip, but actually that encouraged more people to come in, and even though it was separate, they still enjoyed it very much. So yeah, there are ways to reconcile that, definitely. And we also, within our work, within our team, there's a lot of conversations about creating those corridors and those stepping stones for animals to come through. So we really do talk about it as well. So I think interdisciplinary collaboration.
I think we're on a journey. So ecosystem services basically says, what can nature do for us? And it's not really very helpful for nature at all. But I think that's how you start that journey. You have to have that right to get the economists and get the monies flowing. But actually, as you say, is what can we do for nature? How can we help nature with the corridors and everything, and understanding a lot more? That's definitely coming in, but we have to address that balance. So like equine therapy is for horses. And I remember a whole lot of vets saying, because they were saying the horse can help humans. They say, what about the humans helping the horse? How's that going to interact? And it should be two-way. And we're still stuck a little bit on the ecosystem services bit. But I think that's okay, because I think that's a starter. And we should just shift into understanding what can we do for nature.
Yeah, thank you. I agree, and the ecosystem services concept is useful for communicating this topic. But there is also an element of we need to address the reciprocity, and there are models for that. I wanted to say that something that I forgot right now. It was super clever, but when it comes to reciprocity, no, right. So first of all, I think you are right, Marta, this thing that you were saying that, yeah, we need to work interdisciplinary, of course, and we need to work together with ecologists to understand what is needed also for nature and for preserving biodiversity. And then I think we need to reframe how we consider health. Human health is defined by WHO as not only the absence of disease, but mental, social, and physical health and well-being. And I think we should redefine it to say that health is living in harmony with nature within the planetary boundaries. And to say that, it again becomes kind of implicit that we can interact with nature, because it's critical, it's crucial for our health, and we are, after all, a species, part of nature. And now it was about to come back to me, but I lost it again. Yeah, I will pick it up again anyhow.
I think the only thing that I would add to that is, I think when I was researching the definition of nature for my slide pack, but I didn't actually end up including it, it's really interesting that the Oxford Dictionary definition separates people from nature. And I think what was just being said about actually kind of people being in harmony in nature is really key to ensuring that nature is protected, but also humans reap the benefits of being in nature.
The social benefits and benefits to the public purse are obvious, but we're in a housing crisis. We're desperate to build houses, and as part of that process, there's a pressure to reduce regulation and loosen up planning policies. How do we ensure that these objectives are met? Do we need greater regulation to ensure that green spaces are built in and in the right way? And who's to pay for the upkeep? Is it the cost-resistant developer or the cash-trapped local authority? Thank you.
If I
I agree. We need. No, it's not something. No, regulations is something I believe in. And then who's going to pay? The problem is, of course, that these money sit in different budgets. But as we mentioned before, there are cost savings. There's significant cost savings. That is also enough evidence on that. We know that we can save a lot of money by investing in nature. So I guess if we could just put it all into the same pot or something, we would have money. But I'm not from the UK. I don't know how it works here perfectly well. So I hand over to you.
I think touching upon the maintenance costs, I think that is kind of key to unlocking in order to ensure that nature or natural space is included within developments. And I'm not going to pretend that I've got the answer, but I think certainly pension funds and pension funds investing in housing potentially may well help solve the issue of leaseholds and freeholds being kind of flipped within sort of 5 years of a development being built. A pension fund is more likely to have a longer sort of view in terms of the investment over, I think, a 25-year period from a talk I went to a few weeks ago. And I think certainly if that dial is flipped, then there is potential for more interest in nature-based spaces because it is looking at the longer term rather than the shorter term.
I will also add that apparently there are very interesting additions, changes to the biodiversity net gain regulations, whereby when you do a development and you sort of remove a certain amount of nature, you need to compensate for that. And when you commit to creating a certain biodiverse habitat, I think from what I understand before, it was that you created and sort of on day one, it's checked that that habitat is there. But apparently now it's the case that you need to maintain it for 25 to 30 years. So throughout those years, it's the developer's responsibility to make sure that the habitats they sort of committed to maintaining are still there and the conditions are there and it's well maintained. So that regulation apparently is now sort of in effect.
Just probably a little kind of side on this. So I chair a group for the West Midlands Combined Authority for health, and it's about physical activity. But what we've converted it in is to make the whole West Midlands an outdoor region. And the reason I'm saying that is because the mayor and the leaders of the West Midlands want to make sure the outdoors is a place that people want to be there, they want to live, they want to come, they want to work. And the only way that's going to happen is if nature and people are connected together. So if there's leadership from the top and all the local authorities fall into line, they won't fall into line completely because some of them hate the local authority, there's all sorts of politics, but actually every single one of them has realised, yes, we want a good outdoors for people to come and live and work and stay in the West Midlands. And I think there's that overarching leadership that could be used to help then these difficult decisions being made. And we'll see how that goes. It may work, it may not work, but I think leadership is going to be essential to make this happen so that those balances can be corrected and it's not just left to the markets or whatever.
I think we have time for one more question, but please keep it very short. One final question.
Thank you. I don't know if it'll be very short, but I'll try to make it short. We talked about green spaces and we talked a bit about buildings and gardens and high density cities. There's many reasons why high density is beneficial in cities, but intuitively that goes against access to green space. So also there's lots of complexity about what we need about green space. So the question is, based on all of that and your experience, is it actually just a trade-off or can you make both work the same way?
On that one, I'm not sure I heard the very first bit of your question, but so I just wanted to bring up to attention, you've probably heard of it, the 15 minutes city, yeah? So that I see that could work, and we know there are examples from that internationally where it actually works, where you have this kind of clusters. So everything should be accessible within 15 minutes within the city. So you have your green space, you have your school, you have your work, you have your leisure, whatever. So you don't need cars, for example. We need to get rid of cars from the cities. That's also something we don't need to discuss. It's obvious. So yeah, so because for sure that is, we are discussing that the need for densification for climate reasons, and then of course we can use and again you probably know much more about this, innovative design and using the roofs and the facades and everything to make it green, to get our ecosystem services also in dense cities.
So in that context, we don't have a, or at least I don't have a clear solution as always. But that's something that we quite often deal with and try to approach and find an answer to it with high rises that the practice does a lot of. So I guess the simple solutions can be with creating like rooftop terraces, yes, but also sort of terraces throughout the height of the skyscraper, and having those community spaces. Balconies in those cases are very beneficial, and also maybe there should be some kind of network of skyscrapers where you coordinate with a different one to have a green terrace, so that you see it from one skyscraper, you observe like the top of a different one that's slightly lower down, and maybe it should be this sort of coordination perhaps even, and also connections between them on a horizontal level above the street level, which can really help with just making it psychologically more accessible as well.
Amazing. Thank you so much. Thank you to all of you who have asked so many interesting questions and who have made it so interactive. There are a couple of other people I'd like to thank. Thank you, David Howard. Thank you, Juliet Carpenter. And thank you, Nino Paulus, for your kind assistance with organizing this series of seminars. And please join me in thanking our amazing speakers for their provocative questions and for their insights. And then please join us for drinks and nibbles, unless David wants to say something else. But thank you so much again.
Sorry, I was just going to say, we're finishing with a wall of thanks, but thank you to the King's Foundation as ever for funding these seminars, for Luca for organising, and to the audience some great questions, and to our speakers for some excellent contributions. So thank you, Matilda, Sophie, Marta and William. So do enjoy refreshments at the back, where next seminars are coming on the 29th of September. No, 29th of April. And the question will be, can the arts heal? And on the 7th of June, we'll have a seminar that's looking at what we learn from the past in terms of villages, small towns, for future sustainable cities. So thank you all and enjoy the evening. Thank you.